Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're talking about critical thinking. So critical thinking is one of those phrases you're going to hear like every day. Every day in nursing school we talk about critical thinking. But we don't always necessarily define critical thinking or what it means to be a critical thinker, and sometimes students get confused about like, well, what is that? What am I supposed to do? You're saying I'm supposed to critically think, but I don't even know what that means, right? So that's actually why I wanted to make this video, because I want to kind of clear that up and hopefully make it a little bit easier to understand. Critically thinking is deliberately looking at information and like analyzing, really understanding that information before we can make a decision or a choice about that, okay? So you can use critical thinking in absolutely everything in life, but in nursing school, we're focusing on a couple of areas. We're focusing on patient care, right? So doing the right things for our patients present a certain way, and we're gonna use critical thinking to figure out what that is and how to best care for them. And then also on exams, right? You need to use good critical thinking skills when you take those NCLEX style questions in order to answer them correctly. Oftentimes, students will confuse critical thinking and problem solving because there are a lot of like similarities between those two things, but they are not exactly the same thing, okay? So I don't want you to go, oh, critical thinking, yeah, that's the same as problem solving, because it's not. There are a lot of parallels between critical thinking, the nursing process, and the scientific method. The thing about critical thinking, though, it's not linear. Like, the nursing process is linear, right? We have to do it in a certain order. You have to do your assessment first, then you have to do your diagnosis second, right? So that's how it works with the nursing process. That's not necessarily how it works with critical thinking. You kind of have to do everything at once. And so I don't want you to look at this because I put numbers next to it as step 1, step 2, because that's not what it is. So these are the things you have to do. So you have to formulate your question, which is very similar to the scientific method of, formulating a hypothesis, right? Gather your data, which is similar to the nursing process of assessing, right? Getting all of our information. Applying that information that we've gotten. Considering the implications. So before you do anything about it, okay, before you do anything about the information that you have gotten, you need to think about what are the potential consequences of my actions? What are the possible benefits? What are the possible risks? Are you aware of any possible benefits or risks, or is it just something that you don't know what's going to happen, right? So consider that. And then also consider the point of view of others. So you're always looking at something from the nurse's perspective because you're the nurse, right? But you also need to think about it from the patient's perspective. How does the patient feel about this? What about their family members? How do they feel about this? That kind of thing. So it is natural and normal for us to think about everything as the nurse because we are the nurse. That's what we do, right? But we need to consider the point of view of others. Critical thinkers don't just make decisions for other people and say, this is what you're doing, right? We still work with each other, okay? So we work with others as a team. So we're coming up with our question, gathering our data, applying that information, considering the possible consequences of our actions, and then considering how other people might perceive our choices. So that is an example of how to work through the critical thinking process. Critical thinking involves problem solving and decision making and is more than just memorizing a bunch of facts about stuff. So if you're on an exam and you have a question that's, asking a fact, asking like a definition or something, that's not a critical thinking question, that's a knowledge-based question. That's what we call a lower level question. Higher level questions, critical thinking questions, involve like analysis. So you'll get a patient scenario and then what would the nurse do, and then you'll have your 4 options, and then you have to think, okay, what would happen if I choose this answer? If I choose answer A and I do this, what are the end results going to be for this patient? So you need to think about the possible consequences of your choices before you make the choice. That's a big part of critical thinking. Questions you want to ask when presented with information are things like, is this from a credible source? So is this information from someone or something that I trust? Is there anything missing from this? Are there other points of view that could possibly explain this information? Why do I care? Should I care about this information? Is it really important? Or maybe it's not really important. And then I've made a decision, but how do I know that information? How do I know what I know? Is it because I read it in a book or an article? I learned it in school. I've seen it, firsthand in real life. How do I know the things that I know? So these are also things you want to think about when you critically think. When we critically think, we want to look at all of the different angles, our key points, and all of the evidence we have before we make a decision. So I think the best analogy to use when describing critical thinking is like a detective. They don't just show up to the crime scene, see the dead body, and then see the person over there next to the dead body going, oh my God, and then go, well, you're the closest, so therefore you're the killer, right? They don't do that, right? They actually look for information to find proof and evidence of who the bad guy is, right? So that's how they critically think, and we can do that too, just maybe with not such dramatic terms, right? So you could do that on a test. You can do that when you have a patient presenting with certain symptoms, and hey, maybe you've had a patient like that before. They've had similar symptoms, and that person had this disease, so maybe this person has that same thing because you've experienced this before. That's the big thing about critical thinking too, is you're always getting better at it. It's not like as soon as you graduate from nursing school, you're going to be the best at it, right? You're going to learn. As soon as you graduate, you're going to be better at it than you were on day one. And then as soon as you start working, you're going to be better at it than you were after you graduated. And then 20 years from now, when you're still working as a nurse, you're going to be even better at it. It's a skill that we are always developing and always getting better at as nurses, because it does kind of feed into our own previous experiences. We use our previous experiences, things we've seen, to help us kind of process this new information. So let's say you've been a nurse for a couple of years now. You're very, very familiar with a certain patient population type. Somebody comes in and they have almost, everything classic of that patient population type that you're used to. Critically, you're going to go, I think they might have this disorder, but you're not going to jump to it, right? You're going to analyze all the information and make sure that it all matches up. So you're going to use that information, you're going to use the advice of others, scholarly journals, your own previous experience. All of these things are going to help you gather the evidence, because we also talk about evidence-based practice a lot in nursing school too. They go hand in hand. Everything we do is based on evidence, right? And so when we critically think, we need to use that evidence that we've been presented and that we've learned before we would make a decision. Critical thinking involves not taking things at face value. So for example, if the CNA or the nursing assistant, the assistive personnel, were to present you with some vital signs, and she says that she took the patient's temperature and she got 92 degrees Fahrenheit, are you going to just go, oh, okay, thank you, and then document that? No, you're going to look into that, right? Because that's a crazy number, right? That's not a normal number that a person should be. So you're going to look into that and go, oh, hey, you know what? This thermometer that you've been using is broken, right? Or whatever other variables are going on. You need to look into that information. You're not going to just take that as, gospel and say, okay, thank you, right? So that's what critical thinking does. That's a very simple example of how to critically think. You need to look into possible alternatives to the things that you are presented with. You need to ask why. Why do I care? What's going on? How is this affecting my patient? All of these sorts of questions you always need to be thinking about when it comes to anything with your patients. Critical thinking also involves making connections. And so some things we can make connections with in nursing are our signs and symptoms and the way that our patient is presenting. So let's do an example of that. We have a patient. Their respiratory rate is 8 breaths per minute. Their oxygen is 87% on room air. They have a decreased level of consciousness, and they were diagnosed with pneumonia. And then you've recently given them a narcotic, an IV narcotic, like a Dilaudid. So a non-critical thinker is just going to jump and go, oh, okay, so they have the low oxygen, they have the low respiratory rate, and they have the pneumonia. Obviously, those are all related because those are all respiratory things. Those are all oxygenated things. And they're totally disregarding the fact that they have a decreased level of consciousness and that they were given a narcotic, okay? But somebody who does critically think is going to go, hold on, let's not jump to conclusions here. This might not be a pneumonia-related thing, right? And you're going to make the connections between the low O2, the low respiratory rate, the decreased level of consciousness, and the narcotic, okay? So you're gonna go, I don't think this is because of the pneumonia. I think this is because of the narcotic administration. So that's what a critical thinker does. They don't just jump to, ooh, this goes together, so that's what it is, right? They go, hold on, let's take a step back and really, really look at this information and analyze it before we make a decision. Critical thinking is a skill that you get better at the more you do it. And you're not going to just use this in school, and you're not going to just use this in your job. If you use critical thinking in your everyday life, it's actually going to make it better and easier for you to do in school and in your job. So, for example, how can we use this in our everyday life? I'm sure we've all seen those studies. They come out every once in a while, and they say things like, red meat is good for you. You know, beef, cow products, that's good for you. And then you'll see another one says, no, it's horrible for you, don't do it. Or drink red wine, or don't drink red wine, right? There are always like conflicting studies that come out every now and again. So an automatic thinker is going to read that headline, cheeseburgers are good for you, and they're going to go, oh, cheeseburgers are good for me, awesome, I'm going to go eat 6, right? A critical thinker is going to go, hold on, let's look into that. Why are they saying this, right? And they're going to read the article. Automatic thinkers are title readers, headline readers. Critical thinkers read the whole thing, right? Because you want to actually look at the information that's being presented and think about it, analyze that information. You got to question, is there a bias? Was this article, paid for by like the Beef Association or something like that? Why did they write it? Did they have anything to prove, to gain, to lose by writing this information? Is this even relatable? Well, I'm allergic to that stuff anyway, so I don't even eat it, right? Or what about the opinions of others? So are you going to believe this one article that says cheeseburgers are good, or are you going to believe the 100 other articles that says cheeseburgers are bad, right? So a critical thinker looks at all of the information before making a decision. We don't automatically jump onto things, right? We're not bandwagon jumpers. That's not what critical thinkers are. We are thoughtful, reflective, pausers, analyzers, and then decision makers. That's critical thinking. And the more you do it every day in your everyday life, the better you're going to get at it in your professional life or in your school life. So that was my video on critical thinking. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.